My name is Lindsey Adler. I'm a pelvic health therapist at Norton Specialty Rehab in St. Matthews. Today, I want to talk about something that often gets overlooked but makes a huge difference in daily life: bowel and bladder changes in Parkinson's disease, and how pelvic floor physical therapy can help improve comfort, control, and confidence. We usually think of Parkinson's as a movement disorder, tremor, stiffness, and slowness. But Parkinson's also affects the automatic functions of the body, the ones we don't consciously think about, like how the bladder fills and empties or how the bowels move. That's why more than half of people with Parkinson's experience bladder symptoms, and about the same number deal with constipation or bowel difficulty. These symptoms can interrupt sleep, limit social activities, impact hygiene, and affect mood. But here's the good news: they are treatable. Let's start with the basics. The pelvic floor is a group of muscles that form a hammock at the bottom of the pelvis. These muscles help support your bladder, bowel, and other organs. They control when and how you go to the bathroom. They coordinate with your breathing and posture muscles and play a role in sexual function. They also play a role in balance. When these muscles are dysfunctional, it can lead to several life-impacting symptoms. And Parkinson's can make it harder for these muscles to coordinate smoothly. Parkinson's affects the muscles in the core and pelvic floor, and also the autonomic nervous system, which controls bowel and bladder function. For the bladder, that may mean the bladder becomes overactive, giving you that gotta go now feeling even when the bladder's not full. You may wake up several times at night. You might leak on the way to the toilet. Conversely, you may not fully empty your bladder, which can lead to chronic urinary tract infections. For the bowels, it often means movement through the colon slows down. That's constipation. The pelvic muscles may not relax well when it's time to go, leading to straining or incomplete emptying with bowel movement. And medications can sometimes contribute to these issues, most commonly increasing constipation. These issues are more than inconvenient. When you're rushing to the bathroom, you're at a higher risk for falls. If you're constipated, your abdomen can feel bloated, your appetite decreases, and your medications might not absorb as well. When your abdomen hurts, your posture and walking patterns also change and can contribute to a shuffled gait or walking pattern. If you're getting up several times at night, your sleep and energy suffer. So, treating bowel and bladder symptoms helps your whole body, mobility, safety, mood, and quality of life. So, how can physical therapy help? Pelvic floor therapists are trained to look at how the muscles, posture, breathing, and daily habits all work together. We assess things like: are the pelvic floor muscles too tight or too weak? Are they working in coordination with your diaphragm and your core? How are you positioning yourself on the toilet? Are there patterns of urgency or withholding that make things worse? Then we create an individualized plan: gentle, private, and respectful. Focus on restoring control and improving comfort. A pelvic floor therapy plan for someone with Parkinson's might include education, understanding how your bladder and bowels work and how Parkinson's changes those signals; breathing and relaxation training, learning to let the pelvic muscles relax during bowel movements and to reduce urgency with urination; pelvic floor muscle exercises, strengthening or coordinating the muscles that support continence; bladder retraining, practicing urge control and timed voiding; toileting techniques, finding those positions and routines that make emptying easier; manual therapy or gentle stretching if the muscles are too tight; adjusting your current exercises to incorporate a pelvic component; combining strategies to improve more than one area of life with the same exercise. Everything is tailored to your body and comfort level and to improve your confidence and independence in an environment free of embarrassment and judgment. Here are a few simple things you can start doing at home. For constipation, Sit with your knees a little higher than the hips. A small stool under your feet helps. Lean forward slightly. Rest your elbows on your knees. Breathe out gently instead of straining with bowel movement. Stay hydrated and add fiber slowly if your body tolerates it. Keep moving. Even seated exercises helps your gut move. Use a schedule to make sure you are urinating every 2 to 4 hours, not just in case. When you feel urgency, pause, breathe, and stay calm. Don't rush. Limit caffeine and avoid bladder irritants like carbonation or artificial sweeteners. Try gentle pelvic floor squeezes, more commonly known as Kegels, to help calm an urgent bladder. You should be able to contract the muscles in your pelvic floor without squeezing your glutes or sucking in your stomach. A visualization can help you find this muscle group. Pretend you are picking up a blueberry with your vagina or anus. Lift the imaginary blueberry up toward your belly button and then gently place it back down. That's a Kegel. Pelvic floor therapy works best as part of your rehab team. We collaborate closely with your physicians, movement disorder physical and occupational therapists, and speech therapists. It may come as a surprise, but breathing and swallowing are linked to pelvic floor function. When we work together, the results go far beyond the bowel or bladder. They impact your daily function. As a pelvic health provider, I have seen people reduce their bathroom trips from 6 times a night to just 1 or 2. Others finally have regular bowel movements after years of struggle. I have seen improvements in balance and core control, decreases in pain, and improved safety with bathroom trips. I have also seen a reduction in urinary tract infections, which decreases hospital stays and reduces risks of systemic infections. We are aiming for outcomes that improve dignity, confidence, health, and a better quality of life. So, just to recap a few things from today, bowel and bladder symptoms are very common in Parkinson's, and they are treatable. Pelvic floor therapy is gentle, individualized, and focused on your goals. Managing these symptoms helps with sleep, balance, energy, and independence. If these issues sound familiar, talk with your neurologist or movement therapist about a referral to pelvic floor physical therapy. You deserve to feel comfortable and confident in your body. Thank you so much for being here and for being willing to talk about something that really matters. Again, I am Lindsey Adler, and I work as a pelvic floor therapist at Norton Specialty Rehab in St. Matthews. I appreciate you taking time to learn about pelvic floor therapy.